how soon is too soon, and when does it actually become premature ejaculation. Although one of the most common concerns in men's health, it is the least openly discussed concern in men's health. Many men silently have this condition or suffer from this condition, and along with it they deal with the frustration, anxiety and relationship distress associated with this condition, without knowing that premature ejaculation actually is not a disease, but it's actually a medical condition which, when diagnosed correctly, can be treated effectively, and the couple can have a good sexual relationship with avoiding the frustration, ignorance and anxiety associated with it. In this video, let's understand what PME actually is, how it is diagnosed, and most importantly, why it happens and that it is treatable. So what is premature ejaculation? It refers to ejaculation that happens sooner or earlier than desired, leading to dissatisfaction or to not reaching orgasm for the male or for the woman, or the male reaches orgasm quicker than the woman. So there is lack of control and there is ejaculation before it is desired. There is no exact definition for the timing. So a fixed timing below which it is called premature ejaculation would be making it too simple. It is not that simple, because sexual experiences differ by person to person and by couple to couple, and therefore there is no fixed timing for premature ejaculation. But when this loss of control and the ejaculation occurs before one desires, probably less than 1 to 3 minutes is what we generally consider, although we cannot use a stop clock, but that is what we consider, is usually when the premature ejaculation is there, which is severe. Mind you, there is subjective premature ejaculation where even 5-7 minutes is considered less by some couples, and there needs to be some amount of education regarding the timing, which is actually near normal. So the concern usually becomes significant when, on most of the occasions, so 9 out of 10 times, there is loss of control, premature ejaculation earlier than one desires, and when it is causing frustration or anxiety and it is affecting the relationship, that is when it becomes significant. Some men experience this issue of premature ejaculation from the beginning or from the first sexual encounter. This is what we call as primary or lifelong premature ejaculation, and some experience it at later stages of life due to some events which suddenly leads to, or sometimes gradually leads to, decrease in the timing or loss of control. Why does premature ejaculation happen? There is no single cause. It is a multifactorial problem, and that's multifactorial etiology. So the premature ejaculation, or we'll discuss the ejaculatory reflexes when there is insertion, the gland sensitivity or sensations play a role, then there is friction, the signals go to the brain, and there is a neurotransmitter serotonin which actually controls the ejaculation. So dysregulated serotonin levels also can lead to premature ejaculation. Dysregulated serotonin levels can also lead to premature ejaculation. Increased sensitivity of the tip of the penis can lead to premature ejaculation, or probably a tight introitus or high levels of friction can lead to premature ejaculation. So these are the basic physiological areas which can lead to premature ejaculation. In addition to this, it is a multifactorial phenomena, behavioral phenomena. Performance anxiety, stress, relationship problems, hormonal factors and past experiences, in addition to what I mentioned, can actually lead to premature ejaculation. Sometimes even erectile dysfunction can present as premature ejaculation. That means the erection, which achieve a good amount of erection, a large amount of stimulation is required, and therefore you almost reach that threshold of ejaculation, and therefore ED can also present as premature ejaculation. One single point, performance anxiety, is when a man is stressed, he is anxious, and when he is anxious, the erection is there and the ejaculation naturally occurs early. So anxiety leads to premature ejaculation, and experience of premature ejaculation leads to anxiety next time. So it's a vicious cycle. They start self-diagnosing via the internet. They start timing their response. They start thinking about this before even starting intercourse. They start self-medicating, and they start taking random supplements without knowing actually what is the cause, what is the treatment. But proper treatment starts with proper diagnosis and not assumptions. So how is PMA diagnosed? The diagnosis of premature ejaculation is definitely clinical and clinical only. There are no investigations which can diagnose premature ejaculation. The conversation itself with the couple, or sometimes only the male, is what will help us diagnose PMA. The sexual act or the experiences of whether he achieves a good erection, and then during intercourse, is it that he feels the sensitivity or excitement in his mind or locally, and whether it happens consistently, whether it happens in certain situations of performance anxiety or in certain positions or with a certain particular partner also sometimes. That is what will help in diagnosing and identifying the cause. Once the symptoms are assessed and we know whether it is transient PME or it has been from the beginning, that is when we can make a treatment protocol or treatment plan for an individual patient. The treatment will depend upon the amount of treatment and the diagnosis. Once we have the diagnosis, we plan treatment will depend upon the amount of stress or anxiety or the amount of relationship stress between a couple. That is what will help in diagnosing and then actually planning treatment. Depending on the individual's situation, other external factors, diabetes, thyroid and other illnesses will be assessed. Relationship factors will be assessed. Stress and anxiety will be assessed and actually can be addressed by simple measures. Hormonal health and lifestyle habits also need to be assessed. So for a couple or a man, there is no need to be embarrassed during the evaluation. Always the expert or the therapist or an andrologist will make the patient feel comfortable. They will let the patient share things and then we'll discuss so that it becomes a comfortable situation wherein there will be non-judgmental sharing of information and therefore the right treatment path can be decided. So what is the treatment of premature ejaculation? The treatment of premature ejaculation works on three fronts. One is the medical front, which will be to modulate the serotonin levels. Second is the behavioral front, where natural methods of delaying premature ejaculation, which I might discuss in future reels or in my future videos, natural methods of premature ejaculation, delaying ejaculation. And the third is psychosexual or psychological counseling, particularly when there is performance anxiety which is playing a role. So a combination of these three are used depending on the severity of premature ejaculation and the type of premature ejaculation. Medical therapy, there are tablets which can be taken daily if one is regularly sexually active or on demand, or there are gels or sprays for the tip of the penis to reduce sensitivity. All these will be customized for the patient or for the couple. It is not necessary that you will require lifelong therapy with these drugs, because sometimes the anxiety and stress is so much to tide over that initial therapy with medicines and then shift over to natural methods, behavioral therapy and different sexual positioning and working on the sensitivity and arousability of the mind, because mind you, premature ejaculation, you reach a peak very quickly and they reach the peak of ejaculation quickly. So how to stay in that phase of plateau, all that those training happens simultaneously, but initially for motivation and success, medications are started and then we try to shift to the other therapies, that is behavioral and psychosexual counseling. The biggest problem of premature ejaculation is not the problem itself, but it is the embarrassment, the anxiety, the stress and the misinformation related to it. Men's sexual health deserves the same attention as any other health or medical condition. The earlier the conversation begins, the earlier you are able to approach someone, the better the clarity and the right path for treatment can be made. And remember, it is not a disease, it is a condition. So it's not something which one should be ashamed of. If you found this video informative, share it with someone who might need it, who might need real productive information rather than misinformation about premature ejaculation. And subscribe to the channel for more men's health and fertility related content, evidence-based content.